So should you practice teleoptometry? Well, in this video, I'm gonna share with you the pros and cons of teleoptometry, as well as my thoughts on remote optometric care. Hey everybody, I'm Dr. Ryan Corte, and this is Ryan Reflects. Today, we're gonna dive into the buzzword and the buzz topic of teleoptometry, a topic that has gained a lot of steam and a lot of traction since the pandemic. Make sure to hang around till the end of the video so you can hear my personal thoughts on the topic. Let's start with the pros of teleoptometry. Access to comprehensive eye care. The United States is a big country and coverage gaps exist in various areas of the states. So more populated areas like your cities and your suburbs, yeah, there's probably access to a lot of optometric care. But you start to get into the more rural or less populated regions, teleoptometry has a lot of opportunity in those areas. Not to mention, as an optometrist, hey, you may want to take a vacation here and there, and maybe you don't have the adequate backup coverage to fill in. Maybe you have maternity leave or you're out sick. Teleoptometry can help bridge the gap during those time periods, some expected, some unexpected, to provide patients with access to comprehensive eye care. Increased flexibility to the provider. With the birth of teleoptometry, optometrists now have the ability to work from home, really, and work from anywhere. So this could be in another office space, this could be while they're traveling, this could be when they're back visiting family who lives across the state or the country. So it adds that extra layer of flexibility to log in and, with the appropriate tools and connectivity, provide comprehensive patient care. Added convenience to the patient. We live in a very me-driven world. What can you do for me right now? How can you help me? Is kind of the thought process of a lot of our patients. And so if they want to be seen in the morning or in the evening or maybe on the weekends, teleoptometry helps bridge the gap to provide patient care for your patients when they want to be seen. Cost savings to the practice or corporation. For anybody who's implementing teleoptometry and they're trying to cover multiple locations, they have the ability to hire less physical optometrists to do so, because the optometrist has the ability to remote in, and they can remote into one location at the 10 o'clock slot, and then another location at the 10:30 slot, and another location at the 11 o'clock slot, however that wants to be kind of scheduled and broken down. Big picture is you can cover multiple locations with an optometrist depending on the volume of patients that need to be seen and the support that you have in place. Here are some of the cons of teleoptometry. Inability to effectively provide medical and specialty eye care. Medical and specialized optometry are the present and future of optometric care, and I just don't see teleoptometry taking the place of these kind of services that really need to be done in person. For example, if somebody comes in and you need to get a better view of the retina and the periphery, dilating that patient's eyes and getting a peripheral retina view is a best practice and standard of care. On the other side of the coin, if you're fitting a scleral contact lens, could you imagine doing that through teleoptometry? It's already time intensive and very specialized in itself. So again, it's not conducive to provide these kinds of optometric services. Technology issues. IT issues happen, outages occur, and it's really frustrating, right, when it happens. See what I did right there? The reality is outages, frozen screens, delays, connectivity lags can really interrupt your ability to provide teleoptometric care. So if you don't have a good system in place, if you don't have good IT support, it's gonna be a bumpy road. Optometric technician limitations. The information collected via a teleoptometry exam is done by an optometric technician who does the typical pre-testing data, but also some of the clinical information that you would see, like slit lamp, is also done by them. When providing teleoptometric care, you are limited to the competency, the training, and the personal motivation of the optometric technician that is capturing that information. For example, if they weren't trained very well, you may get some faulty data or just data that doesn't give you the full picture of the exam. Or if they're just kind of checking the box, hey, I don't really want to work here, I'm just doing it for a paycheck, you may get a lack of effort to support your clinical care. A less personalized doctor-patient relationship. In-person eye care will always be superior to remote teleoptometric care. Just that genuine human interaction and relationship is so much better when you're face-to-face in person. Supplementing it with here and there teleoptometric care, especially if you're the provider that's consistently providing the patient care, probably not a bad way to bridge the gap and continue that relationship if you're physically unavailable to be there. But that doctor-patient relationship year over year is best established and cultivated and built when you are in person with your patient base. Regulatory limitations. Teleoptometry is very new, and so some states and their state boards are more open and favorable towards it, and other state boards are not. And so you definitely want to check and see, are you able to provide teleoptometric care in your state? Or if you are working from, let's just say, another state, let's say you live in Michigan and you want to provide teleoptometric care in a state like North Carolina, you have to be licensed in the state that you're providing care. So you're going to need multiple licenses. Some of those licenses are easier to get than others. And so it's something to be mindful when you sign up for providing teleoptometric care, specifically if you're doing so out of state. So here are my thoughts on teleoptometric care. Personally, when I first heard about it and how it was picking up traction in our profession, I was guarded, I was reserved, I was skeptical. I didn't want it to overtake the doctor-patient relationship. I didn't want it to overtake the profession. I was nervous about the quality that we could provide, but over time I've evaluated it and I've seen how technology is being implemented and systems are being put in place to adequately provide teleoptometric care in a comprehensive eye exam format. I don't ever seeing it overtaking medical optometry or specialized optometry. I don't ever see it taking the place of that doctor-patient relationship when you're in person. But I really do feel like it gives us the opportunity to expand our reach, to provide care in areas where maybe there is a lack of coverage, to help when somebody's sick, to cover maternity leave, to allow other providers to go on vacation. I'm a big advocate of controlling what you can control in life. And if you can control the system and have adequately trained optometric technicians who come in and know what they're doing, and you have a really good internet setup at the place that you're providing care, and your practice has really good internet setup, I think it's a viable alternative to in-person care to help bridge the gap and to help provide care in times when you can't in person. So what are your thoughts on teleoptometry and providing teleoptometric care in your practice? Let me know in the comments below, and stay tuned for my next video where we can reflect and grow stronger together.